This state of play production is made possible by the generous support of Biogen, where science meets humanity.
Welcome back to State of Play, as we now have a chance to really dig deeply with Professor Alexandre White. Professor White is the Associate Director for the Center of Medical Humanities and Social Medicine. He's an Assistant Professor of both Sociology and the History of Medicine at Johns Hopkins Department of Sociology, as well as the School of Medicine. What an honor to have you with us, Professor White.
It's really a pleasure to be here. Thank you so much.
Professor White, as we look at epidemics, is it true that epidemics have a real powerful impact on all of society in the way that wars do, or Great Depression might? And we've had them since antiquity, so is that the case?
Epidemics have a tremendous impact on a host of things. I think that one of the most important aspects that we're learning today is that epidemics fundamentally lay bare the inequities within our societies, and they exploit these inequities in so many ways. We know that racial segregation, for instance, residential racial segregation is a significant marker and factor in who gets sick from COVID, when, and why. And these issues are not new, nor the racial and economic inequalities that are produced by epidemics, particularly novel in the COVID case. If we can go back to the Black Death in the Middle Ages, where oppressed communities, especially Jewish communities in Europe, were blamed for spreading disease, and as a result, very violent responses were taken against the Jewish community across Europe. Moving, closer to the present day, with similar epidemics of plague in South Africa, for instance, the emergence of bubonic plague in South Africa in 1901 was used as significant justification for producing the first racially segregated townships in South Africa. So disease has not only played a really important role in exposing the inequalities within society, but also exacerbating and producing new forms of dispossession, violence, and oppression.
Are there any particular epidemics or pandemics that stand out? For example, obviously the Black Plague, I think everyone knows about that. And then, of course, we call it the Spanish flu, the terrible pandemic of 1918 that I think started in Kansas, but they call it the Spanish flu. Could you sort of elaborate on that?
Yes. And it was in part, called the Spanish flu because Spain was neutral during World War I. So it was kind of a neutral party to gang up on and produce stigma from or for. And I think that these examples are very important because they attribute blame to the spreading of disease to certain communities or certain groups. And as you mentioned, HIV, the LGBT community and gay community in the United States, especially gay men, were overwhelmingly blamed for the spread of disease. And this had a secondary effect that was very dangerous, which is that the focus came to surround pathologizing gay men and their sexual behavior at the expense of recognizing that this disease spreads just as easily within heterosexual communities and non-gay communities. And this led, of course, to missing a significant portion of the spread of this disease, especially in the early days, while focusing on pathologizing and discriminating against the LGBT community.
In your writings, Professor White, you speak to how all epidemics, all pandemics lay bare the existing inequalities in society. Can you expound upon that?
We've seen that where you're employed, the sort of industries in which you work in, whether or not you can work from home, and class-based questions have a significant role to play in who gets sick and how you get sick. But at the same time, as I mentioned, both healthcare access to vaccine distribution sites, pharmacies, supermarkets, hospitals, all play a significant role in whether or not you can mitigate the worst effects of COVID-19. And we see in the United States especially, disproportionately, lack of access to vaccines occurs within Black and other minoritized communities. and the both access to care and the abilities to prevent the spread of COVID-19 have a very real effect, especially on those who lack the resources or have been historically deprived of the resources to muster against this pandemic.
Has it been your experience that when we come out of these pandemics or epidemics, after the gut-wrenching experience of them, do we ever come out of it smarter? Do we ever come out of it richer as a society as a result of the experience?
Yeah, I think that's a wonderful question, and I think part of what I would suggest, and this is actually what I ask my students, is really how do we, what do we consider change to be in particular ways, and at what scale do we think about change? I think, from a bird's eye view, we could very easily say that we keep repeating the same mistakes, and we certainly do. But on the other hand, I've seen in so many ways the community citizen science responses that were carried out in response to the lack of action, especially from the federal government towards HIV/AIDS, have been brought over into our current pandemic in responses. Community health organizations, faith-based health organizations, and citizen science groups have been leading the charge in helping communities at a micro level that's having really macro effects. And I think that if we look to the ways in which communities have gotten involved, have learned from past pandemics like HIV for their strategies, we do see ways in which we can mitigate these things.
Do you think that COVID-19 in particular made us more sensitive to racial reckoning? I mean, clearly we were brought to a screeching halt because of the pandemic and had little choice but to take note of what happened with George Floyd and therefore the outcry emerging from that experience. Do you think that is not a surprising consequence?
I hope that what this pandemic has laid bare is that, these disparities that we see in society are not just value neutral, that there has to be active oppression to produce the racial inequalities that we see in America. We need to recognize where agency operates in these spaces and work to stand against it. I think there's a lot more focus and a lot more interest and energy in confronting these issues, especially in the ways in which racism presents such a significant toll to health. But, without significant push, and I think at a global level, really fundamentally, we're not going to see the sort of change that we need. So I'm going to keep fighting, and I know many are working very hard on these issues.
WHO suggested that the next pandemic will be far more lethal, far more virulent than the one we experienced with COVID-19. Do you think the world community is paying attention, getting ourselves prepared for such a pandemic?
I hope so. And I think that we see a host of factors operating in relationship internationally to vaccine access and equity. A major force in there is obviously the pharmaceutical companies and the ways in which they seek profit from these much needed life-saving vaccines. But I think internationally, we see the ways in which vaccine access is structured by the desires for profit, which limit equitable access to vaccines. And vaccine equity and health equity for Black and Brown people at home and as well as around the world, and especially in Africa, is the fundamental rights and equity challenge of this pandemic. And it's also, I think, fundamentally the way of preventing the prolonged pandemic occurring. We can sort out these new variants and prevent them if we have much greater vaccine access. And I think that this is critical. And it is as much a racial equity and rights and racial justice question as it is a public health or economic one.
Professor White, are there any clear messages you think that we should garner from these experiences? I mean, whether it's the Black Plague, whether it's the Spanish flu, whether it's HIV/AIDS or COVID-19, is there a consistent message that we should have gotten from each of these experiences?
I mean, I think fundamentally what we've seen is that COVID-19, as most pandemics do, lay bare the deepest inequities in our social orders and our social systems. And I would hope that everyone who's lived through this and experience of this don't forget these inequities exist and work their hardest to mitigate, challenge, and confront them. And that fundamentally healthcare equity, before even a pandemic begins, is a fundamental preventative measure that would offset the major risks of future pandemics.
Well, I think, Professor White, you've done a terrific job of explaining to us how we've been dealing with epidemics and pandemics since antiquity. We've had various episodes throughout world history, and we can anticipate more such experiences. So thank you so very much for sharing your insights and your strong, commanding historical perspective here on State of Play.
I appreciate it. Thank you so much for having me.